No, really. Boo. Yeah, this is my son's bear, Boo. He used to sleep with it all the time, but sadly not too much anymore. But I like to keep him around the house, give me a little reminder of when he was little. Not so little anymore. But today what we're talking about is actually scary. So do you have mysterious health symptoms, such as fatigue, pain, brain fog, or unexplained weight gain, among other issues? These issues can often rob you of your quality of life. Are traditional lab tests and doctors saying nothing is wrong with you? Or maybe doctors are telling you that your chronic symptoms are depression and you need antidepressants. Maybe you've even been accused of complaining too much. It's very sad to say, but I can't tell you how many times I've heard a patient tell me that a doctor told them, "It's all in your head." Are you kidding me? That's terrible. Most people know when something is wrong with them. Even if a lab test come back normal and doctors say you're fine, they just might not know what's wrong with them. This is because the standard healthcare model does not screen for autoimmunity, a disorder that occurs when your immune system attacks and destroys your own tissue. You can suffer from symptoms of undiagnosed autoimmunity for years and even decades before it's actually severe enough to be diagnosed and treated in the conventional medical model. Now, if you've seen my other blogs, you've probably heard me say this before, but I will say it again. I've had patients that are told by doctors all the time to wait until their symptoms get bad enough and then they'll do something about it. This is ridiculous. This is when patients' lab test results are in what we call the suboptimal or subclinical range. A great and easy example is with anemia. A common percent transferrin saturation range is from 15 to 50. So if a woman gets her iron levels tested and it comes back at, say, 16 or 17, they say they're normal. But what if your normal was normally a 25, 35, or 45, and now you're at a 17? Well, that's suboptimal. You could be labeled as normal at 17, but possibly be literally at half of what you used to be. This is what we mean by subclinical or suboptimal. You're still in the normal range, but you're not anywhere near what optimal is. Fortunately, in functional medicine, we can screen for autoimmunity against multiple tissues in the body at once. Knowing an autoimmune reaction is causing your symptoms can remove the mystery and bring a significant peace of mind. It is confirmation your health symptoms are real and proof you're not a whiner or hypochondriac. We take the boo out of it. We identify autoimmunity by testing for antibodies in the blood against particular tissue. For instance, we can screen for Hashimoto's, an autoimmune thyroid disease that causes hypothyroidism, by testing for immune antibodies against thyroid peroxidase, or TPOs, and thyroglobulin, TGBs. Positive results mean autoimmunity is causing your hypothyroid symptoms of weight gain, depression, fatigue, constipation, cold hands, feet, hair loss, whatever. And again, let me be clear, Hashimoto's is not a disease of the thyroid. It's an immune disease that affects the thyroid. Again, there's a difference, and we've covered this in one of my previous blogs. So what is my favorite and really the only test you should use to screen for autoimmunity, you ask? I'm glad you asked. It's a lab test by Cyrex Labs. They're really the only ones that do this type of testing, and especially one that's any good. So Cyrex Labs tests for 24 different types of autoimmunity at once, and this is a general screening. The specific panel is called Array 5 Multiple Autoimmune Reactivity Screen. It is more cost-effective than testing for each autoimmunity individually, and Cyrex Labs are highly sensitive, so they do a really good job. To do this test, simply ask us for a kit if you're a patient, take it to an approved blood draw center, and voila! We'll find out if you're having an autoimmune reaction. So if your test results are positive or equivocal, it means your immune system is attacking that tissue. You may not even have symptoms yet. This is a best case scenario because managing your health with functional medicine can prevent the autoimmunity from progressing. The old saying, an ounce of prevention is worth a pound of cure, is very true in the case of autoimmunity. Well, really anything, but particularly autoimmunity. So Array 5 screens for the following autoimmunities. And I won't get too much into the details, but stomach autoimmunity, intestinal, thyroid, we've got adrenal, cardiac autoimmunity, phospholipid autoimmunity, reproductive organ autoimmunity, It also includes joints, bones, the liver, pancreas, and possibly, most importantly, neurological autoimmunity. Now, if you have no symptoms but a positive result, then you may be able to prevent the autoimmunity from even expressing itself completely or at all. If you have symptoms that correspond with a positive test, other testing may help you track your condition. For instance, if you test positive for Hashimoto's hypothyroidism, follow up with the thyroid test, and you can track the severity. Knowing you have an autoimmune reaction means you can halt its progression and prevent it from worsening. This can mean preventing or reversing devastating and debilitating symptoms. Remember, once you have an autoimmune disease, you can't unring that bell, but you can put it into remission. Remember, an ounce of prevention, you've finished the sentence. I'm Dr. Craig Mortensen. Be healthy, be happy.